was just tired all the time, could not go through one day without needing at minimum like a nap. Felt like I wasn't in control of my own blood sugars. As much as I tried, I just felt like I couldn't quite get a hold of them.
Because you're the boss, you're the CEO of your body, you're the one who is empowered to take care of it.
Mentally, it did take just a huge toll. I just feel like constantly like you're just failing at what it's okay to ask for help, and I think that's where I realized that I definitely needed the added help, and it's made a huge difference.
How did you get care? How did you seek help?
Seeing you get excited over progression makes me more excited and me more want to even make that number, make it better.
I'm going to specifically say hi to all the diabetes warriors. This is an interview session that I am very delighted and I feel extremely honored to do with my patients, and they're literally like extended family members to me. I'm introducing you to Vanessa today, and she is also residing in Central California. And we are just going to talk about her health journey and how she can be a source of inspiration for many of you out there. So welcome, Vanessa, and thank you so much for saying yes to the interview session.
Thank you for including me in this.
We'll start with, just introduce yourself as to, what brought you to seek care, or what experiences have you had about healthcare in general, and why was seeing an endocrinologist or seeking care with your primary care initially crucial for your health?
I've been a type 1 diabetic for almost 20 years now. And before, when I was first receiving endocrinology care, and then I became 21, and I was primarily just seeing my primary physician, which again wasn't just dialed down into my diabetes care. I didn't really feel like I had that really insight on how I could manage my diabetes and improve my A1C. Through just looking around and trying to get into a lot of places, which of course were like 6 months to almost a year out appointments, my doctor actually recommended me to you, and I looked in, and within that week I had an appointment. So since then it's been great.
Thank you. Yes, the timely access is so crucial. Tell me about any symptoms that you were experiencing, or anything, any changes in your health that you noticed, which also justify that, okay, I need to get further care from a primary care physician now, switching to endocrinology.
During that time, I can say I was experiencing mainly fatigue, both just physically. I was just tired all the time. I definitely was feeling like I could not go through one day without needing at minimum like a nap, and just not really being as motivated as I was before. I also just experiencing a lot of just like diabetes burnout. I felt like I wasn't in control of my own blood sugars. As much as I tried, I just felt like I couldn't quite get a hold of them. Once I did just routine blood work with my primary care, I noticed we started noticing a little bit of changes on my thyroid levels. When I really hit me that I needed to get in endocrinology care for better understanding, better care of taking care of my hormones.
A couple of very important aspects. You talked about fatigue. You also talked about diabetes distress or burnout.
Yes.
And that's in our physician world, we talk about physician burnout, and that's because there is a phenomena happening in healthcare system where we're just asked to see more patients, and of course you cannot justify the quality of care. In diabetes, there is this distress and burnout, which is so real because we are constantly in large volume chasing numbers and trying to figure out that, okay, what am I eating? What am I doing? Why is it high? Why is it low? Why can't I just be in a balance? It's very important to empower the one who is going through it, and also have this constant, continuous support. So going through that burnout is it should be a journey with your healthcare team also. with your family rather than that's one individual dealing with all the responsibilities of this condition. So tell me what happened next, like the changes in or your experiences transitioning from one aspect of your care, your medical care, to now your next step in your health journey.
Almost being a diabetic for almost 20 years now, and being able to go see you, I can say that I'm learning even more things now that I thought, for the most part, I thought I knew what type 1 diabetes was. And now realizing that there's so much things that, even though I was always kind of made out to seem like I'm in control of my diabetes, everything that affects my blood sugars, I can control. I've now realized that there are some things that just, are out of my control, just being stressed, or even temperatures, or so many things that affect my blood sugar, that now I realize that some of these things, as much as I want to control them, some of the things I just have to learn to kind of adapt to these changes.
Exactly.
And it's made it a lot better, a lot less also like mentally straining of thinking that everything was my fault all the time.
There was a time that we were very concerned about the low blood sugars.
Yeah, so I think that at first I had a few more constant blood sugars, mainly, again, just I feel like it was a effect of chasing a high. My solution to everything before was just give more insulin, give more insulin.
Mm.
And for those many years, I was just making my body just more insulin resistant by giving more and more insulin. And since then, I'd say now that I'm a little bit more control of it, I can predict these lows before they become an issue, before I start to feel them. And it's been a lot less now.
I just want to bring this out that individuals who have family members or who have friends or who don't know anything about type 1 diabetes, it's not that it's just a high blood sugar or a low blood sugar thing, but the amount of interventions, the amount of time, the amount of attentiveness that is needed is commendable for anyone who is dealing with type 1 diabetes. What was your experience with pumps?
With pumps, I've felt a huge difference, especially now. With the Omnipod, I feel like that's definitely helped me a lot, just in the sense that I can catch those highs before they come too high, or my own pump will back off giving some insulin before I go too low. Seems very insignificant, the very, very tiny bit of insulin that it adds or takes away, but it's made huge difference.
Basically, diabetes technology is what Vanessa is mentioning, and there are lots of gadgets which are very useful and which eliminate the use of constant injections or injectables in individuals requiring insulin. The emotional, mental, psychological part of the well-being. Did that impact your daily routine or your ambitions, your career?
I mean, it definitely, I feel like just mentally, it did take just a huge toll. Sometimes not understanding why your blood sugars are going up, or not understanding why your blood sugars are going down, and you just feel like constantly like you're just failing at what. I think that was the main part where I felt like my diabetes and just blood sugars in general were just spiraling out.
How did you get care? How did you seek help?
So I think during that time was around the time where I noticed my thyroid antibodies were coming up on blood work. So I think that's when I realized, like, I can't do this on my own. Like, I definitely need help. And even though I was going to a primary care, like, just the attention to detail and just really having an endocrinologist really read these numbers and just explain to you why this is going on. I think that's where I really needed the help, just understanding.
I wanted to shine some light here that anyone with type 1 diabetes is an autoimmune condition. And it can coexist with other autoimmune conditions, and thyroid disease, like either hyper or hypothyroidism, that needs to be screened for anyone with type 1 diabetes. And there are a few others. I also make sure that celiac disease testing is done. And of course, you look at the physical examination. And that's where the TPO antibodies play a role, because who knows what's causing the fatigue?
Mhm.
Knows what's adding on to the insulin resistance other than, a larger amount of insulin injections. Has this condition ever made you feel that you cannot accomplish your goals or become as ambitious as you are right now? Would you be any different?
I think it definitely did in the past. Before when I first started off with diabetes, and I feel like I went through that really rocky stage where my blood sugars just weren't, my A1C wasn't where I wish it would be. Again, I would get talks from doctors just, always explaining the negatives and your kidneys and which things that all, again, I knew, but I wasn't exactly getting okay, this is how you combat that. This is how you do better. This is how we delay those effects to your kidney. And it did for a second, made me feel like, well, these doctors keep telling me that my kidneys are going to be done in a few years. So it definitely did kind of make me not as ambitious as trying to achieve my goals, because in my mind I thought, well, if my kidneys are eventually not going to go well, who even knows if I'll even, live long enough to achieve those dreams. So it was definitely a lot of like mentally just not really striving for those goals, because again, like I was just being told left and right, like you're doing a bad job. So that's
Mm.
constantly what was in my head. Just doing these recent follow-up, just blood works and exams, I feel like I can do more than what I thought I could do, and just striving to keep doing better, and more so for my mental health, but health in general. And so I definitely feel like now I can not only do better for myself, but I can inspire others as well.
Absolutely, that's the inspiration that I was really seeking that you could share. There is burnout, which can be very easy, and we can get sucked into it. But that's where again, getting the right expertise, support, asking questions, but also getting the positive support. And I feel like as physicians, as healthcare professionals, even as if there's a healthcare industry, and now you are going to be in the healthcare field, that no matter what, we can't have judgment when we're talking to patients. You want to keep that door shut, because where they're coming from, you want to step in their shoes. What are they dealing with? And understand and work with them from where they want to work. And then constantly, I never want to lose hope on my patients, no matter where they are at, right? So it's feeding in a little bit of positivity, feeding in, and making sure that there is a constant communication, there is a constant exchange, and looking at short term but also long term goals. And when
Yes.
you talked about complications, yes, short term goals, we may just fluctuate, or there may be some yo-yos that we talk about in blood sugars. But if our eye is on the prize, that's also a long-term goal, preventing complications and making this as like a second nature, that I can handle it. If I can handle it, I figure out, I seek support, I reach out. And that's where, we exchange messages, we look at CGM periodically. And then knowing that we will prevent complications.
I think just seeing you also like just super excited to see like, well, it's progress. You're not, it's
Mhm.
better. You're not doing worse. And even though to me in my head, I was so used to being like, oh, well, your A1C is down like 1 point, but like we really want to see it here. So it was kind of minimizing like the effort that I was putting in. And now just seeing, like seeing you get excited over, progression makes me more excited and me more want to even make that number make it better. So it's
Mhm.
definitely helped a lot, and it makes me feel a lot better now about tiny little milestones like that.
Yes, yes, you got it. Good. I'm glad. Tell me, where are you at with now feeling about yourself?
I still probably don't feel like I've completely conquered the whole aspect of diabetes, but I do feel more in control as far as I'm able to recognize, just looking at trends and looking at where what I've noticed works for my body. And before, I feel like part of me almost pretended like I wasn't diabetic, and I just didn't want to think about it. And now I'm able to really kind of dial down on what I notice. I notice if I'm having a really stressful day, or if I'm, menstruating that week, like I can expect almost what's going to happen. And I feel like I can kind of get ahead of these blood sugars. Whereas
Hmm.
before I was chasing them and, trying to fight what had already happened. And now get ahead of it. So I definitely do feel like I'm a lot more in control.
And life is uncertain.
Yeah.
So we may think that things will get better once this is accomplished, or this month is over, or once, these tasks are accomplished, but there may be new ones, new surprises coming along. And, for me, what conquer your health means that you've conquered your mindset,
Mm.
that it's going to be positive. And, how do we start that is by affirming it to yourself. One thing I always remind this to every individual, every patient that I come across, or even physicians, that never call your patient as a diabetic patient. This patient has diabetes. Okay, we are not adding an adjective to a human being. A human being is a human being. So today, as you are sharing your story, I'll challenge you, take this word off and just say, I have type 1 diabetes, but not that I am a diabetic. Okay, so now since we know what the present moment is, can you describe any specific moments or any milestones that mark a significant improvement in your health?
I think seeing my A1C at the most current level where it is, I think it's been years where I hadn't seen that number before. And that although it's not, the greatest number, like I said, like it's still a huge improvement of where I was before. So not being so hard on myself and seeing that just really that I told my mom when I got my A1C, and she was even so happy for me. She's like, I don't think you've been at that level in like years since like you were first diagnosed. So she was super excited for me, and it just makes me feel like I'm going in the right path. So it definitely helps.
So if Vanessa today is looking at her future, next 5 years, next 10 years, what do you feel?
Being almost in complete control, where I can definitely, even now, I think every month has gotten better and better.
How about, when someone else is diagnosed with type 1 diabetes, so you're going to go into healthcare field, right? If you're on the other side now, you're being the clinician, or you're being the expert, or you're being the healthcare provider as such, and you see someone with type 1 diabetes struggling like you were in the past, what would you tell her or him now?
I went through that, and I'm testimony that it can get better with proper knowledge and proper diet, lifestyle choices.
I would suggest, think about this, that make it as your second nature rather than making it as a chore or a task. Just get into the system of how to tackle, how to deal with the problem or a challenge which is coming along with diabetes, specifically type 1 diabetes. Be it medications, be it, the coverages, be it the pump issues or technology troubleshooting, or even there's something called as diabetes or blood sugar rage. That why the heck is that not coming down? But if it becomes your second nature, because you're the boss, you're the CEO of your body, you're the one who is empowered to take care of it, right? So don't ever let the disease or the condition or type 1 diabetes conquer your mindset. It should be the other way.
Thank you so much. I mean, I enjoyed being able to, it's a long run, and it's a journey. And even though you'll have your ups and downs, it always, like I said, it always gets better. It's really important to just have, I think, just a great healthcare provider, a great, just advice, and not just close yourself to thinking and blaming yourself that you are the reason why you're not getting any better. Sometimes it's okay to ask for help, and I think that's where I realized that I definitely needed the added help, and it's made a huge difference.
Thank you so much, Vanessa. Thank you. I really loved the conversation, and I would invite more viewers. If you are, spread this to the community. If you know anyone with diabetes, be it type 1 or type 2. And I look forward to seeing many more of you in our future interviews. Thank you so much.
Thank you.